Thank you very much for coming. What would be great if you could, Julia, thank you.
My pleasure.
If
Norma.
you could give everyone a little background on, and take time to do it, a little bit of history of what you do, where you do it, how you do it, and then I can start asking the questions around that.
Okay. You'd like me to start now?
Yes.
Okay, I will. So, my name is Julia Smith, and for background, let's see, I did the MD PhD program. That is a joint NIH-sponsored program. In fact, I was the first woman in the program nationally. That dates me. It's a long time ago. And that program is a 6-year program that includes medical school and then a PhD doctorate. My work was in cell biology, and then my postdoc in molecular biology and molecular genetics. My training was in medicine, and then I did training in oncology, hematology and oncology. My postdoc work was in molecular genetics, and so my interest clinically was in oncology, cancer care. And one of the main reasons I was interested in that, there were a few reasons. One reason is that an oncologist, someone who cares for someone with cancer, takes care of the whole person, the whole body. If you are a renal, a kidney specialist, a pulmonary, a lung specialist, a cardiologist even, you're very focused on those organs. Mm-hmm. But if you're an oncologist, you really are taking care of the entire body and the entire person, and obviously also their extended family. So I like that. Mm-hmm. Also, right at the time that I was training, was a time that oncology was changing, as it is again now. And at that time, the field of molecular understanding, genetics, was becoming, it just burst open. And that allowed us to bring something of the research, the bench research, to the patient and to the clinical setting, which is what I was interested in.
And specifically at that time, what was different? What were the things you could bring to the patient?
Well, the thing that really changed the whole field of cancer genetics, which is what I specialize in, was that in the mid-90s, a woman named Mary Claire King cloned the BRCA genes, the BRCA1 and 2 genes.
And
those are the
genes,
Angelina Jolie genes.
Right.
The BRCA genes are genes that everyone's born with a BRCA gene, and certain mutations in those genes, certain changes in those genes, you wouldn't know you have them because they're just formed in the embryo and you're born with them, but those changes confer a significantly increased lifetime risk of certain cancers. And that was an amazing sort of eye-opener for the country, for the world, and for the medical community, because nobody believed that there was any possibility that there could be a genetic basis to cancer.
You're born with, So does this test happen automatically when you get a checkup, or is it a specific test you have to ask for?
Right. It doesn't happen automatically. It is very important that people become aware, because now it's not just the BRCA gene. Since that time, we opened the Bellevue Clinic, a free clinic to help women who might be at risk in the late 90s once these genes were cloned.
Right.
And since that time, we've opened a major center at the NYU Cancer Institute that I'm the clinical director of, and we see all patients, men and women, because a large number of genes, since the BRCA genes have been discovered,
really,
and confer risk. And it's very important for people to know exactly what you're saying. Even though I spent a lot of time lecturing around the country, around the city, I go all the time to give grand rounds and tumor board. Doctors are very busy, and they're very focused on what they know they have to do.
Right.
This is a new field, relatively, and many are aware now, but they don't have it rolled into a seamless way of sort of translating it to patient care. So you are right, the people out there, you have to look, the individual has to look. Ask.
And so what do we ask for? What do we specifically ask for? And which doctor do we ask to do it? Do we have to ask an oncologist? Do we have to, I mean, I don't necessarily want to see an oncologist if I'm not feeling like cancer I need to deal, but I want to know. So can anybody do that?
Anyone can actually send the test. Don't use those sort of commercial tests
that you get on Amazon.
Right. Don't use those.
Okay.
There may be, the 23andMe may have some decent accuracy for the BRCA, but not for any of the other genes, and not always for all the BRCA mutations either.
Yeah.
So you're throwing your money away, and it's not reliable.
Okay.
Which doctor can you go to? Any doctor can send the test, but there aren't that many doctors who are really familiar with how to do it. So the best thing to do is many gynecologists are good at this.
Oh, interesting.
And I know you're going to have Dina Harris on later.
I am. I have the works here. We have a full
that's great.
spectrum.
And she does it, in her office, and many gynecologists do who are aware of this.
Great.
Internists can do it, surgeons can do it.
And what are we asking for?
So people should look to their family and personal medical background. And if they have a family history of cancer, or some diseases that are related to cancer, like a lot of fibroids or, growths, things like that, they should be thinking, could there be a reason why my family is getting more cancers than the average?
Okay.
So the things to sort of think about, the tips to think about are, cancer unfortunately is not uncommon in our society. Yeah. But there are certain patterns that are uncommon and should make one think this could be something unusual that might indicate a hereditary basis. So think about whether a first-degree relative, that means a mother, a sister, a child, has had breast cancer premenopausally, under 50, breast cancer, that is actually unusual.
Okay.
It happens plenty, but it's not the common scenario with breast cancer.
So that's an alarm. That's
a red flag.
Let's do something.
Exactly.
Let's take care of that. So, and the name of it is just a genetic test?
Yeah, ask for a multi-gene panel, because you don't want just the BRCA usually anymore, because now we know it's not enough. Many other genes confer risk. And you can find out, you're thinking, oh, there's breast cancer in my family, and you get a multi-gene panel genetic test, and you find out that there is a gene, but it's linked to colon cancer. Colon cancer is usually a preventable death if you know to screen in a different way.
Exactly.
Yeah.
Very interesting. And one more question on this. And so this would involve men too, then?
Absolutely.
So men should ask the same
Absolutely.
questions.
And men, that's an important point, Norma. Men carry these genes exactly the same way, and they transmit them to their offspring the same way, and they received them from their parents the same way.
Okay. Well, that's a big boost of new information there. That's super helpful. And so I interrupted you with all of that curiosity about the BRCA gene, but, and so you were talking about your interest got sparked originally when this genetic information came about, and now you're saying there's even more, and that we have a broader spectrum of information we can gather.
Yes.
Now, what else is really revolutionary that's either happening now on the horizon, or you see is something real that we'll be able to look at when it comes to cancer?
Yeah, this is a really exciting time, again, in cancer therapy now. Immunotherapy, basically, molecular therapy, genetic therapy of cancer means, and that's when people talk about personalized cancer therapy or individualized, what that means is you look at the tumor cell and you see certain characteristics that are specific to that abnormal tumor mutated cell, and then you attack with an agent just those cells.
Awesome.
And that is a great advance because, number one, obviously you're going to get better efficacy at destroying the cancer cells, and number two, you're going to hope to get less effect on normal cells, less side effects, less toxicity, and much more efficacious. So what we're trying to do, and it, you know, in many cases it's now going to become a reality, is turn the diseases, the cancer diseases, into either curable or chronic diseases that people have to live with but can live with.
Yeah, amazing. And what percentage of people who have cancer are using this new technology or find out they have cancer? What percentage are we at now?
Are we talking about the targeting, personalized? It's still a fairly small percentage because it's not out in the community as much yet, but it's spreading. And there are, most of the community hospitals are using some of it.
Okay.
Absolutely. So I think within the next few years, certainly 5 years, it will be
in
standard.
The population.
Absolutely.
Unbelievable. That is really great news.
Yeah, it's great.
One of the exciting things about my curiosity is I've gotten involved with some AI projects, and I had a tutorial in Abu Dhabi about AI, and I said, I know a little, but I don't know, you know, what AI can do. And when they did the portion on medicine and AI, first on everything, my head was spinning. I was like, oh my God, this is unbelievable. How much do you realistically think AI is how much of a part is AI gonna play in everything you do going forward, especially in medicine? It seems like the perfect partner.
Right, I think it is. I think the possibilities are not even defined yet. It's enormous. And I think that it will bring the community of the world together into a very sort of concentrated ball where everything will be able to be managed much more seamlessly. I think just like we've seen with the instigation of electronic medical records, which is, the sort of the small calf of the AI, there are going to be problems. There are going to be complications instituting it. It's going to be, but I think it has enormous potential. Enormous.
I mean, it is just sort of like dream big dreams. Yeah. And that really is in that place, and it's fantastic. You and I were on a panel together, and we fell in love. Yeah,
absolutely.
And too unlikely fall in love, but we fell in love. Plus, we're in the same generation, so we think a lot the same. And one of the things we talked about was hormones. And you were just so brilliant at this event that I just want to be sure we can cover some of what we talked about. So we were talking about breast cancer and ovarian cancer, and we were talking about who are the likely candidates. How do you get breast cancer? How do you get ovarian? What is it? How does that come about? And you talked about the periods, and when you're pregnant, you have like a little hold time. And I thought that was it was so clear and very easy to understand. And I think we all kind of get that, but I don't think most women truly understand how hormones play such an important role in the life of a woman from puberty to postmenopause. And I'd love to cover some of that with you and everyone, by the way. So tell us a little bit about the hormonal experience for women and how it interacts with what you do.
Right. So, so as you say, hormones are, they're unbelievably important. And for women, there are these major times in our lives that there are really sort of tsunamis. And one is puberty, and another is menopause, and a sort of earthquakes are pregnancies.
I love the words that I'm going to use them forever because I've been using but those are perfect. Tsunamis and earthquakes. Yes. Okay.
So what happens is that until puberty, there are hormones floating around in everyone's body, but for girls, until puberty, the ovaries have not started pumping out hormones. All of a sudden, at puberty, the factory turns on, and this enormous rush of hormones is pumped into the system. And that's why all these parents go crazy when their children hit puberty.
And we went crazy. I was out of control. I remember it well.
I can believe that.
I was out of control.
It must have been fun. So there you are, and all of a sudden, whoosh, this enormous just torrent of hormones is pumped in. Those hormones are, for women, for girls and females, that is predominantly estrogen-related hormones. Estrogen drives breast cancer. So that's why, men get breast cancer. Men have estrogen as women have testosterone, but the balance is different. And there are more, obviously, breast cancers in women than in men. So estrogen drives breast cancer. The longer the breast tissue, which, by the way, starts to proliferate and starts to grow at puberty, the longer that tissue is exposed to circulating hormones, the estrogens and the progesterone cycling through every month, the more at risk the tissue is for abnormal behavior, for becoming abnormal.
Okay, so pause.
Pause.
That was a big statement that I guarantee you most of the people listening to this have heard for the first time. And the idea that at puberty, estrogen starts flowing, our breasts are growing, every time we menstruate, estrogen's flowing through, including through our breasts, and this is when we're vulnerable.
Right.
Unbelievable.
Right. And in general, proliferating tissue, growing tissue, is more sort of at risk for damage than tissue that's just staying quiet.
So that leads me to ask, if a woman, some of these are going to be vanity questions, so you'll have to deal with what you have here.
You look so good that I think I'll take your advice.
So if a woman is gaining weight and losing weight, when she gains weight in her breasts, does that make her more vulnerable?
Oh, that's a great question. I've never been asked that, Norma.
Well, that's why I'm here, to ask those questions that nobody...
And the answer is no. Not in terms of, well, I shouldn't say it's an absolute no. It's no in terms of, do you have more risk the larger your breasts are?
Well, if they're growing...
But it's not no in terms of the proliferation and the fat.
That's what I mean.
That's a very important point that you're bringing up.
That's my question. So if you're gaining weight and losing weight and gaining weight, which a lot of people do, I know if I gain weight, my breasts are the first.
Right.
Not even my face, which I would be happy for, but my breasts, and I have no idea why, and maybe at this point in my life they are for a certain reason. And I always wonder, when I get my breasts checked, am I more vulnerable when my breasts are fuller?
Yeah, that's a fascinating question, actually. I'm thinking about it as you're asking it. In terms of we know that size of breast does not confer
Right.
risk, but we also know that body mass index, fat, and in particular fat distribution in women, is a risk factor. And that's why it's so important for everyone to really pay attention to lifestyle issues,
Yes.
really pay attention. And it's not just weight, it's also diet, it's also exercise, and those three things are independent risk factors.
You're speaking my language.
It's very important.
Yeah.
So all these things, you want to keep a lean body mass. The more fat cells you have on your body, the more you are at risk.
Yeah. You know, in the fashion industry and in women's self-esteem right now, especially on social media, we want to accept women the way they are. We want to accept women in their authentic selves and everything about them, whether it's their noses, face, skin tone, colors, oddities, eccentricities in the way they look, just because that's what they were born into the world looking like. And one of my concerns is, I also believe that everybody's body type is their body type, and trying to be something else is so bad for your head. But where I'm concerned is that fine line where women who have fuller bodies or thicker bodies are celebrated. I'm concerned to be careful not to celebrate poor health, because there is no substitution for health.
Right.
And we can't just be tolerant and accepting of everyone if they're not eating properly, if they're not moving, and if their body mass is so built on fat, and it makes them vulnerable.
That's the key.
Yeah, so I am so happy to have a professional, a very respected professional, make this statement so that the idea of a healthy lifestyle becomes more important as self-expression, but
Absolutely.
more important than just accepting poor health as an okay option.
It's not okay.
It's not.
It's not okay, and it is fixable. I mean, yes, I agree with you. We should accept the way people are different and celebrate that even.
Yes.
But everyone should be striving for good health, and being different does not mean being, out of control or slovenly. It means trying to take care of yourself.
Yeah.
And having a different body type, you may have more muscle, you may have more of a different distribution.
Exactly.
But that's fine.
Yeah.
But you still want you want the fat to be turned into muscle, and you want to make sure that you don't have to be thin, but you have to have a body mass index that's healthy.
And I think once we're so concerned about being politically correct now, that for me to voice this concern that I have, because I do believe healthy lifestyle is the key to the best life for everyone. For me to voice this concern is very provocative in the politically correct landscape we're in right now. And I'm for sure saying I find appreciation in small breasts, big hips, big breasts, small hips, all of it. It's great. It's just like having a face like nobody else's. But I do have an absolute concern when women especially, and men, but women especially, are not understanding the value of having a quality life with a healthy lifestyle. And when you're young is the time to really act on it, to just say, I'm going to do this now, and it's going to happen right away. So this is super helpful.
I think that's really important. And the young, people when they're young, they're very focused on other things. They're very tied up with their social life, with their career. That's totally understandable. We all were. But you cannot do that at the expense of your health. And, you can't say to yourself, well, I'm just going to eat macaroni and chips because I'm too busy to take care of myself. It's really important, and there's no question, we know, and the evidence is there, that in terms of lifestyle, these things matter in terms of risk of many cancers, not just breast cancer, many cancers. So your body mass index, making sure that you take care of yourself and you exercise, you keep your body mass index in a healthy range, making sure that you eat properly. Don't put junk into your body. It makes a big difference in the long run. Making sure that you exercise regularly and effectively. And, really you have to do a lot of exercise, at least 3 or 4 times a week, at least 30 to 40 minutes.
And move every day. I mean, just make movement, take the stairs, do things. One of the things that in this conversation, I have so many questions to ask, but so for young girls, I work in the public schools and I'm around this age group, and I have so much to say and that I want to be done for these girls, because nobody explains to a child that's going through puberty, that is about to go through puberty or going through puberty, what is really happening to her. We've never had, there's no handbook, there's no instructions, you just go through it, and all of a sudden this girl who had one type of a personality all of a sudden is in another zone completely, and her interests are different, her behavior is different, her skill sets change, and her body, I know, I just blew up. I mean, I wasn't huge, but all of a sudden, not only did I have breasts and hips, but I had this body that was just rounder, and all of a sudden I didn't know what to do with it.
Right.
Is there anything, so number one, that transition time, what do we know about it? What do we know, and how can we communicate to these 10-year-olds or 9-year-olds at this point? What exactly? That's another conversation.
That's a question. Why is that getting younger?
Yeah, so why is it getting younger?
Well, I think that it's getting younger it's a number of reasons, but one of the main reasons is diet and environment.
Diet, I know.
Diet and environment. You cannot have these young children gaining, a lot of fat cells. You cannot have them taking a lot of these preservatives into their system, and you certainly cannot have them, this is something I really believe. I think the cosmetic industry has not been properly regulated. It has not been studied or regulated. And I think that you see all these young girls using an enormous amount of products, whether those products are cosmetic or cleansing or whatever. And those products, many of them, are pro-estrogenic. They cause an estrogen effect in the body. And then we've got the milk that's got hormones in it. So these young...
And meat with hormones in it,
and milk.
And pesticides and everything. I mean, I absolutely think one of the most important things a mother can do if she loves her children is to make sure they understand the importance of making good food the celebration, not the birthday cake, not the candy.
Right.
Why celebrate with something that's poisoning your child?
Right.
Never introduce that as a celebration, but celebrate colorful, beautiful vegetables.
That's a great idea.
And make a beautiful bouquet of gorgeous food that tastes good, and celebrate it with joy, and make sure they believe you, and that you're not jamming chocolate chip cookies, behind a door somewhere, and really do that. And I think if that's embedded in those early childhood years, by the time this girl is going through menopause, through puberty, she's equipped because she's eating the right food and keeping active. Just like going through menopause.
That's right.
If you're eating crappy food and drinking and doing bad stuff, you are gonna just have a horrible time.
Hard time. And that's one thing that I just want to also point out in terms of lifestyle stuff, in terms of diet. Everyone hates me when I say this, but don't drink. Don't drink alcohol. Okay, does one drink here and there hurt you? Probably not. I'm not saying you have to be abstinent, but this idea that you can drink every day or have a
glass of wine every day,
that is not okay.
No.
And for a long time we have believed that particular factor increased the risk of breast cancer, and now the data is clear. It's very clear. And so people need to really be aware that alcohol is bad for you. Obviously, everyone knows cigarettes are bad for you. You should never smoke.
That's a given. But
alcohol too.
Yeah. So the smoking is still in the culture for late teens and 20s. I still see people smoking in that age group, people I know that I would like to just strangle, but I breathe and say, please think about this. But I think
and the
alcohol, e-cigarettes, we can't even, it's just, alcohol for me is very interesting because I don't drink. I've never felt comfortable with alcohol. And one of the things early on, I started to identify when I would eat certain things, I wouldn't feel good. And I wouldn't feel good over a period of time. I've been very connected to that as a young girl.
Yeah, that's interesting.
And so my father was so happy that he could afford steak, for us to have steak, but not steak every once in a while, every day. We're proud. We can have steak every day. And the pain of sitting at the dinner table for me was just something I couldn't tolerate. I would have to go lie down because my stomach hurt so much when I ate the meat. And finally, I was able to find my way around that. And so I stopped eating meat, not because I was saving cows or animals. I just was a city girl and I'd never seen animals anyway, but I just didn't feel good. And then there's something about Guinness Stout. When I would go to London, I loved the smell of it. I loved the taste of it. But 2 inches down on a glass, I would start sneezing and coughing with an allergic reaction. And sometimes I would take it and I'm okay. This is so delicious, thick, and it has such a great taste. But in the end, I would just have a bad reaction. And so one of the things that I think has been super helpful for me is my body reacts really quickly to anything that I'm allergic to. And so it screams to me to stop.
But it's your awareness that's interesting to me, even as a young person. That's really a great trait, and that's something that you would, if you could teach that,
share, and
that's amazing to be connected that way and aware. That's fabulous.
And then I also noticed that when your body is having an allergic reaction to something, you not only could have sneezing, coughing, but if you look at any woman, especially someone early 30s, no longer 20s, but 30s on up, when they drink the night before, the next day, it's not pretty. No. It's not a pretty sight. And so the younger you are, the faster it passes, and the
Right.
recovery is faster. But as you get older, that look sort of stays with you. Not one day, maybe 2 days, and then if you're having another drink, it just sort of becomes your look.
Right.
And you can actually look at someone, especially a woman, and see, bet she's having a glass of wine every night.
Right.
I wonder if that wouldn't be enough of a deterrent to
Right.
say, oh
Right.
my God, you know,
Right.
this isn't looking good. And vanity is a great way to be healthy.
Yeah, but you're right. I mean, it changes your skin, it changes your muscles, it changes your metabolism, so it's going to show. But yeah, that's, the other thing is that, of course, people in general, as they age, become less tolerant to the effects of alcohol. Mm-hmm. So if you aren't as in touch as you were as a young person, you can become in touch if you pay attention, or as you get into your 30s and 40s, that it is different to have a drink and how you feel in the morning than when you were younger. And that difference is not a good difference.
Yeah.
And you can change it.
And so I've been talking about that a lot, and it isn't popular. And but
no.
when I talk about menopause, and that there is zero tolerance. If you're, I would say, from 44 to 46, you're knowing something's happening to your body. You're seeing signs. You're getting the signal. There absolutely alcohol should not touch your lips at all. And by the time you've hit 46, if you're still having a drink, you're crazy. And why do they tell pregnant women not to drink?
Right.
What? So,
Right.
what else do we need to know
Right.
that alcohol is not necessarily what used to be socially acceptable and okay? So, which leads me to CBD and all of these things. Does this, when we talk about cancer and we talk about how sometimes the pain of cancer and how people go through it, and right now there isn't enough technology to make sure everybody gets it zapped and they don't get side effects. So how is CBD or any of these drugs used as sort of a support, or is it a valid use of the product?
Well, I think, there is the sort of medical use of marijuana and its products, and then there's the emotional and recreational use. So from a medical point of view, there's no question that for certain chemotherapy agents, marijuana, and I'm talking about smoking marijuana and THC in the smoking, can help with nausea and vomiting that can be chemotherapy induced.
Right.
Because that was, everybody saw that was true, the FDA, the government decided to approve pills that had THC, tetrahydrocannabinol, for people taking chemotherapy.
Right.
That doesn't work.
Really?
It doesn't work.
Really?
And so you have to tell your patients who are having those symptoms to try smoking marijuana, not to take the doctor-prescribed pills.
Oh my God.
Because that doesn't help. So it has its role, for sure. I mean, here again, I have to say I'm a little bit out of step with culture and the current politically acceptable. For instance, and I talk to my kids about this all the time, I don't really think it's a great idea to just totally legalize marijuana. I mean, it's just not, you don't want to be walking down the street and have everybody, sort of having the effects of marijuana bumping into you, driving cars.
Uber drivers,
construction workers. So I actually think that I do think it should be decriminalized. I don't think it should be, there should be jail sentences, but I don't think that you should be able to just walk down the street, smoking or drinking.
Yeah.
We can't walk down the street drinking, so, So there are places where these things have a real role. CBD has not been worked out very well, and I think that has a long way to go in terms of where we should use it and how.
And regulate it.
And regulation.
So there's
and
no
I don't think the
regulation.
idea is just to not regulate things and let people sort of, because society will suffer and people will have problems.
Yeah,
So,
I call it the numbing of America.
Yeah.
I think we are numbing our population. I almost feel like it's a science fiction film, and some foreign country wants to take us down, and by doing
That's not
that,
so far-fetched.
and by infiltrating these huge business opportunities based on these numbing drugs.
Yeah.
There's a chance, if people think they can make a lot of money, that a lot of people jump on it. Therefore, a lot of people will find it available. So where I get my tea, on the counter are brownies with CBD. There's no regulation on them. And I keep thinking they're little brownies. They're as cute as anything,
Right.
just like the gummies. Cute.
Right,
I
right.
got a gift of gummies. I thought, well, it's a good thing I don't eat sugar, because I would eat that whole box. And I didn't know there was CBD in it.
Oh.
And I was like, and it wasn't, it was actually marijuana. It was
that's
so, and when you consume it, it's even more. I thought, what if a 10-year-old girl comes in and sees the brownies and gets 4 of them? And there's no regulation, and you don't know if the batch was mixed properly, and was a whole chunk of it over here, or was it mixed and spread out? And I feel like, oh my God, am I the only one that's freaking out over this and thinks that this is not a good thing?
Well, I'm with you. And I also think that, we have to get, what is the point of civilization? What is the point of a government? It's there to protect the citizens and so we need to get a sort of a grip in society and understand that there are things that that we've structured, and we have to go back to that to protect.
Yeah, I think we definitely, all I say is, what if this were a science fiction film and some country was trying to take us down? Will that provoke people to? But I agree with you. I don't think this is what you put people in jail for. This is not that. Right. But I do think regulation to protect people. I don't want to be in an Uber with a guy who's like stoned.
Right.
I really don't. And I don't want to walk by a construction site where,
or live in a house.
Or something was built, because I want to know that everybody is clear thinking, working at excellence, and doing their best for everybody, for babies, for families, for everyone. Right. So I think starting with the fact that if you're smoking pot and you have chemotherapy and it's chilling it, I say, thank God.
Right.
Thank God. Good. What a great use of this. This is great. On the other hand, regulation, there's no question, is necessary. So if you felt that you were talking to your daughters and young women who were curious about what they needed to know about their health, what they should check and look out for on a regular basis, what advice would you give?
Yeah, I would tell my children, and I do tell my children, boys and girls actually, I think that the points actually that you've been focusing on are very important. Try to be connected to who you are and to your body. Try to listen to and feel what you feel, acknowledge it, and then try to understand where it's coming from. Most young people are healthy, and most young people don't get seriously sick. It happens, but it's actually the exception. So you can go through life not thinking about any of this, but that doesn't pay off later, you know? And so, you know, the things that we're talking about, try to be aware of your sleeping habits, try to be aware of your eating habits, your exercise habits, whether you're sitting all day or moving. Get up and move if you've been sitting. Be aware of what you're putting into your body. If you start to have symptoms, you know, do not just go on the internet and Google.
Right.
Google. I
Right.
get calls from my kids' friends all the time.
Oh my God.
I had this symptom, so I Googled it. Do I have this?
Right.
Do I have that? You know, you
Yeah.
probably do not have those things. But, you know, have a doctor and a checkup regularly, because that doctor is someone you can bounce all these things off. And, you know, go talk to them about any of these concerns. Have people, older people who you trust, who you can ask questions and confide in. I don't think that young people should focus too much. I think, especially for this particular young generation, they've grown up in a time of great uncertainty in the world. And I think that one thing I see all around me in practice with young men and young women is anxiety. I think it's a huge problem for this generation. And I think it does not help to focus on, do I have this, and and every symptom. What you want to focus is on the good and the ease of living, and you have that for most young people. And I think that it's been a very tough time for these kids to grow up, and I think what they face, a world of uncertainty, is very different than what we faced. So I really think that what they need to do is learn to live in the moment, protect themselves as best they can, and enjoy their good health, and know that that's likely to stay with them.
And protect it. One of the things that I think we need to share is in our childhood, in our generation, and that time, the environment was healthier.
Right.
The food we ate was still, I mean, all of the pesticides but even more of like pumping hormones into food really came about through fast food to produce the biggest, fattiest thing.
Right.
And so our early childhood was really based on, and it wasn't a while before that fast food thing took over everything, but our childhood, less population,
Right.
healthier food, more time for our parents to cook and do the
Not
traditional
so much
things.
electronics, so more
No.
sort of interconnection,
Yeah.
movement,
Touching and
going
interaction.
places.
And so the food we ate, we played outdoors, we were with other kids, playing without play dates. Play date is a new word. Our generation never had a play date. We had the luxury of a childhood that can never happen again. And so we were protected because the environment and the lifestyle was a different one. Our stress was minimalized. I remember there were 3 TV stations.
Right.
And
I remember that.
And Walter Cronkite, for those of you who've never heard of him, Google it. Walter Cronkite actually told the news.
Right.
We got news, and it wasn't some version of the news. It was news, and it was a trusted sounding voice. We had inspiring people in the news. There was Gandhi, there was Martin Luther King, John F. Kennedy.
Right.
We were inspired by the moon landing and all of this stuff. And now the population explosion, the amount of people, the amount of issues with food and farming, and which is why wellness and lifestyle are critical now.
Critical.
And kids now have no choice, even though they can recover from getting sick or health issues, they can recover faster. They have no choice. They must start an early, healthy lifestyle.
Absolutely.
And that has to come from the parents, has to come from the mother. It has to be instilled early on that their survival on this planet will depend on that healthy lifestyle, because the technology, the stress of social media, the stress of knowing the latest, the newest, and being on that treadmill has caused the amount of medication from early ages straight through to now to be part of their lives.
Right.
Like they are living on medication to deal with all of this. And the only way to get off that medication is to have a lifestyle that nurtures and protects your body, because it's about good food, it's about sleep, and it's about moving. And for me, I just want to scream it every day, because it's not loud enough. That warning, it's a warning, it's not loud enough. So when people are most prone to get ill in a serious way, what age is that? Where is the bulk of that, not the sort of the exception?
Yeah, well, the bulk is after 60. That's the
Really?
bulk, yeah. Now, on the other hand, if one survives those high-risk decades, 60s, mid-50s to early 70s, mid-70s, then you've passed the biggest stress test in life.
Really?
Yes.
Really?
And then you are likely to have quite a long, healthy life. So you want to make sure when you're heading into your 50s that you're in good shape.
Yeah, it's really, I think that there are different decades conversations, so by talking about youth and owning it early on, by the time you get into those older years, it's already part of your habit.
Yeah.
And I think now, hopefully, I'm going to try in every way to communicate that. But I think people like you who are immersed in all of the consequences of not only a genetic predisposition, but how lifestyle, even if it's genetic, if you have a healthier lifestyle and genetically
Absolutely.
you're challenged, you can at least
You can
deal
modify
with
that.
it. Yeah.
Absolutely.
So,
That's something important. You know, I have many patients who come in to see me and they have cancer, and they say to me, I just don't understand how this happened to me. I eat well, right, I exercise regularly, I'm so and what I say to them is, listen, some of this is totally out of your control, and you cannot blame yourself for getting sick or getting cancer. But one thing I can tell you is that if you do get sick or you get cancer, coming in with having been strong and healthy makes a huge difference in how you can weather it.
I agree. I agree. I think that's
So it's
such
important.
a bonus to know that you can. Some of the issues about cancer, obviously when people are ill, they feel bad about being less than themselves, and it's really such a challenging time. And one of the things I think is so important is that when people aren't well, it's really a time for us to touch them and to be close to them and to hug them. And we don't touch each other anymore. And I do this thing where I take people's hands and I look in their eyes and I say, when was the last time somebody took your hand? Yeah. Well, for the most part, we have this in our hands, so we have our mobile devices and we don't touch. But I think when somebody is going through cancer especially, or any of those challenging times where your body's ravaged and with all kinds of treatments or whatever else you need to do, or breast reconstruction, all of that, to have someone touch you when you've had your breasts removed and you need reconstruction, just to touch, to give someone a facial, to hold their hand, to do something, I think is the most generous act of kindness you can possibly do for a friend, for your mother, for an aunt, for whoever it is. And you can't buy flowers prettier than doing that. You can't buy a gift But it takes so much from us to do that, because illness is scary, because we don't want to catch it.
Right.
We don't want to get I don't want to get that, and I
Right.
don't want to get too close,
Too
or whatever
close.
it is. And in fact, I think the generosity of spirit of kindness is just the healthiest thing you can give yourself, but also to do that for another person, I think is something we all have to think about. And since we know so many
that.
women who
that.
have cancer, right?
Yeah. I mean, I love that because, I remember, and I know you remember, the decades and the horrible years in the 80s with AIDS and HIV infection. And I remember so well these young, healthy, until this disease, this healthy, vibrant young men, all of a sudden ravaged and their lives destroyed, and everybody was so frightened. And I remember so well seeing someone come into their room, someone they knew come into their room, and they were all so frightened, and someone just hugged them because everyone thought, they were terrified that they could catch
you'd
it
get sick,
by, they thought they could catch
Yeah.
it by hugging them.
Yeah.
And then I remember so well this patient just tears streaming down his face because this person came in and hugged him.
Yeah.
It's really,
I
think that's
remember
really
that
important.
too, but that's our generation.
Yeah.
I remember that too, and I remember hugging friends, and I didn't know if I would catch it or not. I didn't know. I didn't really know. None of us knew, but I just knew that I wasn't going to see my friend anymore.
Yeah.
Two of my friends, and the thought of that was like, I just wanted to give them energy from my body, and it was so painful. And I also remember when my mother was in her last years of her life, and she was very isolated, and she was a very active woman, and so she was home, and I promised that she could stay home, and I would do whatever, and I would visit her and give her facials and massage her hand and brush her hair. And I could see on her face that was really all she needed. That's what she needed, that, and to underestimate that. So I think more and more now, and I've been talking about it more and more, because now with these mobile devices in our hand, we have disconnected emotionally and spiritually from each other, and we communicate our emotion through texts, through emails, through
And that's
social
inadequate.
media.
Totally inadequate.
It's dangerous.
Right.
Because we can be sympathetic, but we can be evil too, in the same stroke of the emoji.
Yes.
And so I think for cancer, especially, there's so much that we can do as friends and as family, and not be afraid that you're going to catch it, because
It's not contagious.
no, but it's spiritually contagious.
Right. But you're right. It's people know at this point. They used to think that, and even not that long ago, well, if it's caused by a virus, because some cancers are caused by virus.
And so tell me about that.
But, well, some cancers are caused, the most sort of obvious example is cervical cancer for women and HPV, human papilloma virus.
Yeah.
And that is a sexually transmitted virus. During intercourse in the semen, the virus is transmitted to, and it infects the cervical cells, the cells of the cervix, and then over time you can develop cancer of the cervix. It's a virally transmitted. You cannot catch that from a hug. You cannot. But there are viruses that cause cancer. Epstein-Barr virus can cause lymphoma. There are viruses, that we know can cause cancer. But those are, and HIV. But these are not any of the. And so it was thought, before anything was known about cancer transmission, maybe you could catch it just by touching someone. And so the cancer patients were ostracized and isolated. And then it was clear that you couldn't in general, but then it became known that viruses did cause some cancers. And so, well, maybe if there's a virus that causes that cancer, if I get too close, that virus could somehow infect me.
Right.
That's not the way it works. So in terms of the medical, physical, you don't have to worry. Cancer is not in any way contagious.
Yeah.
But your point, this issue of, and I think it happens not just with cancer, but anyone who's sick, anyone who's ill. People are afraid to be around them. They're afraid that somehow their world will be infected by illness. And that is actually a counterproductive for, not just for the person who has the illness, but it's counterproductive for the person who's afraid of it, because it's an irrational fear that they are then feeding into and allowing to fester and grow. That will cause them to be depressed and anxious.
Yeah, it's so true. The early on when we were talking about the predisposition to having a gene or something, tell me a little bit about fibroids and that, because
Uterine fibroids.
I come from a family of fibroids and thick breasts and all of that, so I'm like really on it. And
Fibrocystic breast.
Yeah. And so I'm always checking my breasts 100 million times, especially in this age range. I'm there like every 6 months and doing the sonar, radar, whatever it is you do. But I don't think people know enough about why certain people have fibroids and what that, how does that happen? What is a fibroid, and what's the information around that?
Yeah, so fibroids, which can occur in many spots in the body, fibroids are abnormal collections of cells that are not cancerous. They are benign. For the vast majority of fibroids, are totally benign. And it's just a collection of cells that have changed from the normal cell, and they cause this lump usually somewhere. So it can be in the uterus. Fibroids in the uterus can be a problem because the fibroid is not going to cause cancer or anything for the most part, but the uterus is a big muscle. And every time you get your period, that muscle has to contract to stop the bleeding. And if there's something in the way, a lump in the way, it can't contract as well, so you can keep bleeding because the muscle can't contract as well. Well, you can get fibroadenomas, little fibroids, in the breast as well. And that's the fibrous tissue, the connective tissue, not the ducts that produce milk, but the tissue that connects and holds all those ducts together in the breast can form a little lump. And that is a fibroadenoma, or a thickening of that tissue, of that fibrous tissue, fibrocystic breast. That is not cancer. It does not cause cancer. It's troubling to a lot of women because on breast self-exam, it can be hard.
Forget it.
You don't know what you're feeling.
I just surrender. I got to go get my breast checked because I was like, oh my God. I remember when you check your breasts, I have and then they said, look, you can check your breasts, but don't have a nervous breakdown every time you do it.
Right.
I'm saying this for people who are experiencing fibroids, there's a big population of women who have this experience.
Absolutely.
And so I remember the first discovery of fibroids was, you have a little strawberry, and then it turned into an orange, and it was like they keep going through the fruit family, and it's like, it's a cantaloupe, no, it's a watermelon, and so they keep growing and changing, and then you get sort of updates on the garden and what's happening with the fruit variety, but it's disruptive in that you don't have a sense of what's happening, but it is, you can actually feel a difference, and many people have them removed laparoscopically, and that's very successful, which I've done, and I remember when I had it done, it was the beginning
Uterine
of,
fibroids?
yes,
Yeah.
uterine. And and so I remember I heard about this, and everybody was having these things, walking around with blood coming out and all of this, and then I had a wonderful doctor who did it laparoscopically, and I was out the next day.
Yeah.
And I thought, whoa, that's better. So obviously so much has
Right.
improved in making your life comfortable
Right.
and less stressful. But it does mean you have to pay attention a little bit more. I mean, it just means, okay, here's a heads up.
Right.
Make sure you are going to check your breasts and do whatever you have to do.
Right, and you have to go to the doctor.
Yeah.
I mean, women have to know that starting at puberty and shortly after, and certainly if they're sexually active, they've got to go regularly to the gynecologist.
So you're saying at puberty they start going to the
Well,
gynecologist?
they don't have to go at puberty, assuming they're healthy and everything's fine, as long as the parents are, educating them and talking to them. If the parents feel uncomfortable doing that, they should go to the gynecologist, and they don't need to have an internal exam. They don't need to have a pelvic before they're sexually active. That can be really traumatic.
Traumatic, yeah.
But they should have someone to talk to.
Yeah.
And so the parents, you would hope the mother would be doing this. But then once they become sexually active, they should be going regularly to the gynecologist.
Yeah. I'm going to ask everyone today a few questions. This is one question. So a 10-year-old girl all of a sudden realizes that she's bleeding and she doesn't really know very much about it. What would you say from a doctor-mother perspective to this 10-year-old girl about what's happening? I will tell you what my mother did. I was riding a bicycle because I was a tomboy, and I was riding my brother's bicycle, boy's bike, down a very steep hill, and I was very nimble so I could lift it and move it, and I crashed into a tree, but not dramatically. I pulled to the side, and I was wearing white shorts, so I was sure I had internal bleeding from my accident, and I went into the house and I said, Mom, I think I have internal bleeding. I fell on Billy's bike, and she brings me the biggest wad of cotton, which was a Kotex of the 50s,
Right.
which was like a pillow, and she said, here, put this in your panties. And I was like, what? I want to go out and play. I don't want this. And so I was taken down. That was like the end of my life. So now here we are.
It's terrible.
What would you say, using your expertise and also your maternal skills, to this 10-year-old girl?
Well, first of all, I would
If she's 10,
start,
maybe 9. I
Right.
don't know.
Whenever it is, I would start before she gets
Like how
her
before?
period. These days, these days, I think when the kids are, with television and social media and what's going on, I think that by the time they're in the 3rd grade, when they're 8 or 9, they are aware of what's going on. And I think that, you put it in, you have to phrase it in words that they can understand and that don't frighten them. But I would let them know that, and if it's your child, then they should be seeing you go through monthly, cycles. And I would let them see that. I would let them know it's a natural.
Interesting.
It's a natural process, and I would let them know that that is a healthy and happy process, because that is how the species reproduces itself, and that's how they were born. And that is, ultimately what will happen to them, so that if they want to have children, they will be able to have children. But in any case, it will be a healthy life cycle for them. And I remember talking to, my kids make fun of me now because I remember sort of always talking to them. They said, Mom, you always talked about the cycle of life, the cycle of life. But, but I think that is really something that's good to appreciate at a young age, that because you don't know at a young age that there is this kind of, not just this whole what's in front of you, but that will end and then will repeat for others. And I think that's a healthy thing to know. So I would just put it in terms of the cycle of life, personally.
So, so for me,
but I would explain specifically to the girls what's going to happen, and I would have them prepared, and I would say, you just come tell me when this happens, and, we'll take care of this, and we'll make sure
so that there is a prep time.
So they're not shocked when they run into a tree.
But the other part of it is, and I see it, I work with public schools, and I.
What do you do with public schools?
Well, I am a public school, I'm a public school student that I graduated from public schools in New York, and many years ago I was asked to come back to the high school I went to, which the high school, Washington Irving High School.
Oh, Washington Irving.
Was survival of the fittest high
Whoa.
school. Even when I went. And it was all girls then.
And Washington Irving was all girls.
At one point.
I didn't know
and
that.
It was very tough. And it always was tough.
Yeah.
And they actually just shut it recently and created secondary, smaller schools. But so I've gone back in many iterations and doing different things with students in the schools, but the girls in high school, in public schools, really have a tough go of it. Many of them are helping raise the children in the household. Many of them are dealing with parents who are so young that they have boyfriends and have to find a place to go if the boyfriend is there. It's a very common thing, and it's life. It's just life. And but their self-esteem is sincerely challenged. And one of the things that I am so aware of is this girl that is going through puberty, and her self-esteem, her sense of this body she has now, and the power of it, and also the objectification of it, are playing back and forth in her head in her relationship with boys. And in Washington Irving, there were closed-off hallways, and there would be girls giving boys head in the hallway and all kinds of things. And it would just like, oh my God, girls, let's get together here and talk about, what you're doing, and like, where is your power? To own your power, and how do we turn this around? And I realized so much of what they was self-taught, or through a girlfriend or somebody else telling you what this is about. And my concern is that even with a more affluent or the privileged, they're still getting so much information from sort of chatter that goes around that's based on nothing. Now, in our childhood, that happened too. However, we didn't have this magnified sort of social media buzz, and we didn't have
the TV, everything going on those channels.
and the negativity, and so I really feel like there's a need for a handbook or something for these girls to just have it.
Why don't you write one?
Well, I may end up putting something like that into my book, because my book is coming out next year, and I am so concerned about this girl and her education. But like you said, if there is a parent there who can have an intimate conversation and the mother share her experience, that's so helpful, because this is like my mom, and I can be like her. And
it doesn't have to be the mother. It can be any female role model,
yeah, anyone,
any older woman who's been through it, who can help this girl understand, and they'll be so grateful.
Yeah, I'm not sure that it can happen in school, but some of it can. Mm-hmm. But so that's...
Do they have sex education courses where the schools that you've been involved with?
It's tricky.
Yeah.
It's tricky.
Yeah.
Most of it is about preventing pregnancy. Yeah. Most of it is about
STDs.
More of it is protecting the kids, which is really important too. Yeah. But
that does focus on the side that's kind of frightening and negative. Yeah. Right.
So it's assuming that it's okay to be active, and which is then everything goes off into some weird conversation, and not everybody agrees, and I don't know. But so when a woman is facing the information that she has cancer. So because of my breasts, I always have to go back 100 times to have my breast checked, and sometimes, we think you might have, and I sit there experiencing what it's like to believe I have cancer. Right. Because several times that's happened to me throughout my lifetime. Well, we think we may have a problem, and we just want to double check. And so I sit in a room with other women who obviously have heard the same thing. And I think to myself, this moment in time is so excruciating that what now? What happens? Like, what happens at that time? So what is that sort of communication when the facts find that there is a problem, and we have to take care of the problem? And what is that? That moment, to me, in my experiences of thinking, I have cancer and I have to deal with this, where I really believed it from the information. What can you share about that? Not only in the way the woman finds out about it, but then how she should, what can she spiritually put in her head about that situation?
Right. It's just a time. It's a terrifying moment, and it's also surreal because nobody is equipped emotionally to handle that information. Nobody has a blueprint of what they should be doing or how they can manage it. So it throws you at once into fear and terror, and at the same time it throws you into a world where a sphere where you just can't quite comprehend what's going on, and you don't have a way to master that, and you don't know what to do. And on top of that, you have no expertise in the area, so you can't make your own judgment, and so you lose control. You're now not in control of the decisions. Some doctor is telling you what to do, and you have to, go along with that, and that's not how we usually handle our lives. We try to make decisions and have control. So I think that it's very important at that time to just understand that that's what's happening, that that's the natural way to feel at that time, to get support, get someone close to you to be with you, because you won't hear what's being said, and you won't process it, and you can't remember it, and you need someone who's there with you. And I think from the doctor's point of view, the most important thing is to give the information, but make it clear that there is someone in control, and that person who's now the patient does not have to be in control right now, because things are going to be okay and they are going to be taken care of. And somebody knows what they're doing, and how to do it, and it will be a horrible, horrible day, but you will get through it. And in most cases now, thankfully with breast cancer, you will survive it.
Yeah. So, I know that most people can tell you, and I can say too, sometimes the people you love the most act like the biggest idiots when you have the most dilemma. They don't know what to do, they're awkward, they're saying stupid things, and they're irritating the shit out of you, right? And so sometimes you really don't want those people around you. Even though I have to say I have wonderful people around me, I still think they're all capable of acting like jerks if you really need them for something. And so I remember when I was having my fibroid issues, one of the best things the doctor, great guy, did for me was he said, I have 2 patients who have gone through what you're going to go through, and I'm going to ask them if it's okay if you speak with them.
Right.
And they did, and then I did that for people too. And they were so comforting. They told me what I was going to go through. I was able to call them. They then called me to see if I was okay. And I thought, this is the best thing.
Yes.
This is the best thing. My cuckoo relatives, people around me were acting cuckoo, but I knew I could contact those 2 women.
Yeah.
And say, it's like, do you get a pain when,
Right.
yeah, it'll go away.
Right.
And so that was so great. And I feel that cancer has just hit so many people that there has to be sort of a network like this. And I'm sure there are.
There are, and there are very good ones. And that's, I think you're right, because those are the people who know what you're feeling and who can answer your questions. And the people who may love you but are not going through it or have never been through
they're having panic attacks on their own.
And they don't know what you're talking about
and
either,
they're just being stupid. They're just doing, stop doing that. No, I don't want chocolate. No, no. You just want them to be quiet and not stress you out. And it's great that they're there and they love you and they're acting like idiots. But I think the most important thing really is to talk to people who have that firsthand experience, so you can say, I don't know, this is like, what about this reconstruction?
Yeah.
What do you think about it? How does it feel? Does it change?
Yes, just show them. What is it, does this look all right to you?
Yeah.
And I think that comes after that first initial, and that's when you find people who have been through this experience and you talk to them, and there are a lot of very good ways to find them.
And do doctors recommend them?
Oh, absolutely.
They do.
Absolutely.
So it's that.
I think most doctors who deal with cancer, that's something we routinely, advise people to do and talk to them about and give them the resources.
Great.
This is when early years when the BRCA gene was discovered, nobody knew what to do. We knew how to find it because the genetics had been worked out in the technology, but we didn't know what to do to prevent cancer and whether what we were doing was actually preventing cancer. And then we started to understand that, yes, we had ways to prevent it and we could do things. So I remember, this was about 15 years ago, I had all these young women, and you reminded me of this, and these young women who were healthy, but they had this high risk from some mutation they had, and they didn't know what to do. Should they take both their breasts off, do a bilateral prophylactic mastectomy? Should they take their ovaries out so they wouldn't get ovarian cancer? What kind of reconstruction? How are they going to handle their, breastfeeding issues, fertility issues? So I used to do exactly that, and I'd say, because there was nowhere for them to go.
No.
There was nowhere for them to go. So I'd say, look, I'm going to talk to these other young women, see if you can talk to them. And then they would get together in my office, actually.
Oh, that's great.
And I'd have them come to an appointment on the same day.
Awesome.
And then we started a BRCA support group. It's only for young women who are of reproductive age.
Really?
Because there was one, but the women were like 65.
Different issues, different.
And so I think that's and there are many, sort of what I'm pointing out is there are many specific support groups for different issues. And I think that those resources are out there. They're very important. Really good.
Well, I'm getting all of these signals that our time is up, and you and I could speak forever, and hopefully we can meet again and do some more.
Well, I know you have a great day planned.
Yeah, I do. And I think our next foray might be good with an audience where we get questions that are a little bit more specific and could be fun with a group. And thank you so much. You inspired this day. Meeting you really brought right away. I thought, this is so valuable. I need to share her on a bigger scale than these little group things. And you just shared wonderful information for everyone today, and we'll see you again. And thank you so much, Julia.
Well, thank you, Norma.
Appreciate it.
Let's
hold hands.
Let's hold hands. I really enjoyed it. I really enjoy you, and I really love what you're doing.